Hi, my name is Jeremy Langsfeld, and I'm going to present on syphilis. So, syphilis is a sexually transmitted disease, and it comes from the bacterium known as Treponema pallidum. This is a spirochete which is characterized by its corkscrew-like appearance. Syphilis is also known as the Great Pretender because it has characteristics of that of many other diseases. It was discovered by Schouten and Hoffman. It is also a gram-negative bacterium and is also macroaerophilic, very sensitive to oxygen, and so it cannot be cultured in vitro. So that has a big effect on diagnosing it. Here are some CDC facts from 2016. There were 88,000 new cases reported. A large number of these cases are from homosexual relationships, particularly men having sex with other men. With congenital syphilis, that is when a pregnant mother gives it to her child. There are about 650 cases reported in 2016. Transmission is through the abrasions during sexual activity with a syphilitic sore. These sores are called canker sores, and they look very painful. However, they are not. Canker sores appear during the primary stage of syphilis. There are four stages: primary, secondary, the latent stage, and also the tertiary stage. And we'll get more into that right now. The primary stage is when you can be diagnosed by seeing canker sores. These can last for about 3 to 6 weeks before they are healed. They show up in areas such as the vagina, anus, penis, and mouth, any area where the abrasions with the syphilitic sore occurred. Now, if primary syphilis is not treated, it will continue on to the secondary stage of syphilis. In the secondary stage of syphilis, you can get skin rashes and mucous membrane lesions. The skin rashes are not painful, although they look like it, and like in the primary stage, they will eventually go away. Now, another aspect of secondary syphilis is condyloma lata. This is characterized by gray or white lesions in moist areas of the body. You can find these lesions in the armpit area. You can also find them in the mouth or the groin. Now, during secondary syphilis, more symptoms such as fever, headaches, just common cold symptoms will occur. And these also will eventually go away within a certain amount of time. However, if the syphilis is not properly treated, it will progress into further stages, such as the latent stage. The latent stage is when there are no symptoms at all. And the latent stage can happen anytime while you're infected with syphilis. You just may not know it. It's split into two categories: the early latent syphilis and the late latent syphilis. If it is identified before 12 months have passed since the first infection, it's called early latent syphilis. After 12 months, it's called late latent syphilis. Now, this image is good because it shows that you will get your first chancre sores immediately after you are infected with syphilis. After about 6 weeks, you get the secondary symptoms. A little while after that, you will hit the latent stage, and this period of latency can last for several years. So you might not know you have syphilis for several years. And after a long time, if there's no treatment, it can progress into the most fatal stage, which is the tertiary stage. The tertiary stage of syphilis happens 10 to 30 years after the first infection. It basically is super dangerous because it will affect your organ systems. Also, it can affect the eyes, nerves, brain, heart, joints. You will get fatal results if it is not treated. And so the tertiary stage of syphilis is also very rare because people will usually catch it before it reaches this point. Now, some of the strains of syphilis I wanted to talk about are the neurosyphilis strain. This is when the infection has gone to the brain or spinal cord. Also, it can take 4 different forms. This includes the meningovascular, the tabes dorsalis, the general paresis, and the asymptomatic forms. The meningovascular form is when it affects the meninges. The tabes dorsalis forms are when it affects certain aspects of the brain. General Priestess is when you get a mental disorder from the syphilis, and asymptomatic is when it's affected the brain or spinal cord. However, you don't show any symptoms. You can get neurosyphilis during any stage of the infection. However, it's most common to get it 10 to 20 years after the first infection. Ocular syphilis is basically identified whenever you have syphilis and then you also get a ocular disease on top of that. These ocular diseases include uveitis, panuveitis, interstitial keratitis, and retinal vasculitis. This very red irritated eye right here is an example of uveitis, and like neurosyphilis, you can get ocular syphilis during any stage of the infection. Congenital syphilis is the most important strain I wanted to talk about, basically because it is a severe problem and mothers need to know about it. Um, this is when the pregnant mother will pass on the syphilis to her either son or daughter in the womb. 40% of mothers who have syphilis will end up giving it to their child and they will die. Also, more problems can occur, such as miscarriages, stillbirths, so basically when the child dies, and weight abnormalities. So even if the child is born, he or she might not show symptoms. However, if the child is not treated, they will undergo even more serious symptoms, such as jaundice, and they can eventually die. So it's usually mothers will get have a blood test for syphilis during their first prenatal visit because it's vital that doctors know if a mother has syphilis during pregnancies. Now, I wanted to talk a little bit about the pathogenesis of Treponema pallidum. We don't know as much as we would like to know about it because it cannot be cultured in vitro. However, we do know that it has an axial filament, which makes it very quick. It disseminates after inoculation and is very good at evading host immune responses. This is due to it having a very low concentration of surface exposed proteins. Now, the reason why inflammation occurs when someone has syphilis is due to them having lipoproteins. Diagnosis of syphilis is basically through blood tests. The most ideal way to do it would be through dark field microscopy, and this would allow you to see the spirochete shape of syphilis. However, that's not the cheapest way to do it. The cheapest way to do it is through the non-treponemal blood test. This identifies certain biomarkers from the Treponema pallidum, and however is not specific to syphilis, and therefore false readings can occur. The non-treponemal blood test will measure the quantities of G and M immunoglobulins and also anti-lipid antibodies. And if a non-treponemal blood test turns out to be positive, then doctors will then proceed and do a treponemal blood test. This is very specific to the antibodies released to the treponemal pallidum itself. And these antibodies are detectable throughout an entire lifetime. So the treponemal blood test is very good at identifying the bacterium itself. Treatment for it is very consistent. For any part of the syphilis that is primary, during primary stage, you would use benzathine penicillin G, 2.4 million units, and this is administered intramuscularly just once. If it's during the secondary part of syphilis, then you would use 7.2 million units. You wouldn't do it all at once. You would spread it out over a time period of about 3 weeks. If you have something more serious, such as neurosyphilis or ocular syphilis, this is where you get a large dose of about 18 to 24 million units of aqueous crystalline penicillin, and this is just in one day. And you would administer it in about 4 million units every 4 hours. If you're allergic to penicillin, then other options such as doxycycline or tetracycline can be used. And those are the works cited, and that's it. Thank you.